Welcome back to Families in Action on our hometown station, AM 1220 KHTS. Hey, we got Bree with us, don't we, Bob?
Yes, we do. We are in Mental Health Awareness Month, month of May, and we've been talking about different signs and symptoms and how to help if you yourself or someone else may have any sort of a mental health disorder. And I think, what I've picked up in the last however many minutes we've been here is to pay attention to what's going on in your own life. We are sort of the drivers of our own vessel, if you will, and we should pay attention to what's going on in our lives and those around us, but especially in our own lives. You had made a statement during the break where we wouldn't expect necessarily somebody else to be able to diagnose when we have any sort of a physical problem. Right. We need to pay attention to our own bodies. But I think we miss the beat when we're talking about mental health issues. And we need to be more proactive in regular checkups, things like that. So
if any of the symptoms or signs that I've kind of gone over persist longer than 2 weeks, it might be a good idea to just talk to a mental health professional, or your physician.
Right. Because that's, like we said earlier, depression's normal. We all have it. But if it gets in the way of our everyday life, it can turn into what you call clinical depression, where we get ourselves in trouble.
A real big crisis that, many people become unemployed over, jail, drugs, all sorts of different things if you let it go and don't, treat it early.
Yeah, you can get sick. Relationships at home can go sour pretty quickly. Everything.
Yeah, absolutely.
It's just like with that commercial, depression, where does it hurt? Everywhere.
Yes,
right.
Yes.
Everyone.
And so, a couple of things that we can certainly do is we just want to be more aware of it. We go in for regular physical checkups. We're supposed to do them on at least an annual basis. And one of the things that we, I don't know about others, but as I'm thinking back to the physical checkups that I've had with my doctor, I don't ever remember saying to the doctor, let's do a mental health checkup while I'm here.
I know they don't. Well, they're so busy. And
they don't necessarily do that as a standard practice.
No, they don't.
Right. But again, we, in terms of our own well-being, I think that, being proactive means us asking that question.
Right.
Right.
Let me just take a break and just a traffic alert. There's slow traffic on the 14 freeway south near the 5 connector. There's a car that had got on fire and it turned into a brush fire. So we got to be careful. Emergencies crews are on scene. So the lanes are.
So if you're going on the 14 south, pay attention
careful.
to that.
Right.
Folks.
You can also go to hometownstation.com and get more traffic alerts. But again, the 14 by the 5 southbound, a little fire going on.
Nice.
Yeah.
So let's say that we're doing all of that, Bree, and that maybe I'm in a little bit of a depression, or I'm trying to get out of that, or I've identified that with myself. You talked about the different aspects to help get me out of that, but what are some other tools that we could possibly use to get ourselves out of depression, anxiety? If I was to say build a support group around you, what does that look like?
Well, definitely, I believe that getting a good support network, friends, family, whoever, it could be your church, it could be anybody, is key. Because interpersonal relationships are a huge part of the reason why people become depressed, because they're having problems in their interpersonal relationships. And so building that support group of anybody in your community, anybody that you feel comfortable with talking to or who understands is definitely key to maintaining your mental wellness.
But you also don't want to go talk to someone that that's depressed along with you, because it can.
Well, we don't want to feed the behavior.
So
we don't want to feed.
Make sure you're reaching out to people that are positive.
Right.
It's like if you're a drunk and you want to stop drinking, you don't want to go hang out with your drunk friend saying, "Hey."
Right.
Yeah.
Right. Well, definitely people who will be able to help you and lift you up,
right.
And you can find those people, in your community, your good friends.
So a supportive community might consist of a physician, So your doctor, a therapist, certainly a church group or an activities group, friends, family. It's interesting is I think one of the biggest steps that people take in the healing process from any disorders is talking to anybody about it. Like they, so many people just hold it inside. So although you do want to talk to the right people, saying something to somebody is the first step in getting help and building that support.
And a lot of people have their EAP through their work.
That's right.
So that's another good resource that you can use, and
Yeah, employee. If you haven't ever tapped into an employee assistance program, anybody who's got a job just about has
at
some
least a few visits.
Sure, you have some sort of a resource there. Talk to your human resources department about your EAP in your employment, and you can tap into that and get a lot of. There are a lot of resources available. Yeah. What about things like peer groups or like-minded folks, like depression groups or anxiety groups or alcoholism groups?
I think if you were to go to a mental health professional, they would be able to direct you to the appropriate groups in your area,
right?
Or even your local hospital usually has some groups that they run or that they can direct you to. You can also call 211, which is they have that in every city, and it's a resource, and you can tell them what kind of resources you need, and they can direct you to different groups: depression, anxiety, post-traumatic stress, NAMI, in your area. So
Right.
211, just call 211. That's also a really good resource to use.
Good. And before we go on break, I just want to remind people there's slow traffic on the 14 freeway south near the 5 path. There's a car fire, and it's turned into a brush fire, so be careful. Drive slow out there. And you can always go to hometownstation.com for traffic alerts. This is Families in Action on your hometown station, AM 1220 KHTS. We'll be right back. Welcome back to Families in Action on your hometown station, AM 1220 KHTS. Just another warning. There is slow traffic on the 14 south near the 5 connector due to a car fire, which turned into a lightweight brush fire. CHP's there, fire department's there. The 4th and the 5th lanes are closed, so drive careful, please. Bob.
All right. Well, welcome back, everyone. May is Mental Health Month. We are in studio with Bree Bonchet, who is a licensed clinical social worker, and we are talking about the different aspects of mental health, how to prevent, how to see the early warning signs, how to get help. I think before we go any further, we've got a couple of minutes left. I just want everyone to understand that if you are suffering from any sort of a mental health issue, there are tons of resources. I think it's important that you reach out to somebody, and if you reach out and you get somebody that can't directly help you, I guarantee they will give you some resources to get to the right place. If you are in one of the best,
And by the way, if you're reaching out and you don't get what you need from that person, reach out to somebody else.
That's right. Keep
Don't
calling.
let that
Keep
one
calling.
person
Right.
push you away. Get over it. No, go to somebody else.
Right. So there is a national suicide prevention line. The number is 1-800-273-8255. That's 1-800-273-TALK. TALK. Locally,
273-TALK.
273-TALK. Locally, we have, you mentioned Henry Mayo Newhall Hospital is a fantastic resource. There is an emergency room that's 24/7 that can do an evaluation to
Right.
see if
It's never, ever closed. It's always open.
right. There's one of the biggest secrets, I think, and a jewel in our community is that
my.
behavioral health unit over there at Henry Mayo Hospital, 24/7, 365 days a year.
There is mental health professionals 24 hours a day, 7 days a week, every day at Henry Mayo.
And you can walk in and get an
walk in.
evaluation.
That's right.
Don't need an appointment.
Don't need an appointment.
There is always 911. You can call the local sheriffs and they will get you in the right direction. There is a
And the sheriffs aren't going to come arrest anyone. If there's somebody that
No.
needs an evaluation, they will come and evaluate them.
Right.
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 Right. And there's a new modality that's been being trained across the United States called mental health first aid, which is big out there, and a lot of the sheriff's departments and the local places at schools have been trained to be able to be a first responder to somebody that has a mental health issue. And the sheriff's department gets the training and a lot of that stuff where it used to be they would sort of show up blind, if you will, into a crisis and not even be aware that there's a mental health issue. And now they're very much aware of it, so there's no danger of being arrested necessarily without there being a full evaluation.
Right.
They're on Cinema Drive in the Santa Clarita Valley. There is a mental health clinic over there. We also have the National Alliance on Mental Illness, NAMI, which is out in our community as well. There are a lot of great clinicians, and you can also reach the Action 800 helpline at 1-800-367-8336, and we can guide and direct you to either our facility or somewhere else if you need the help.
And also on the back of your insurance card,
correct,
there's an 800 number or a number there that says for mental health purposes, so you can always grab your insurance card and make a phone call.
And get a referral. Get a referral to a therapist and just go in for a checkup.
Yeah. Yep. And I think the most important thing out of all those resources that we just gave out is to ask for help. If you identify with any of the things that we've been going over in the last hour and you feel like yourself or a loved one may be suffering from mental health disorder, it is much better to reach out for help and be wrong about that than the other way around.
What do they say?
Right?
1 out of 4 Americans?
Yeah.
Isn't something like that?
Right. 1 out of 4 Americans has a diagnosable mental illness, which could have easily probably been
prevented or treated.
Right,
sure. So there's actually 4 of us in here. So
so
I'll take it.
I'll take it too.
It's probably me. I'll take it.
So,
yeah.
At least 2.
Yeah. So, Bree, we have a couple of minutes left, and, we've been talking a lot about different things here. What is the sort of big message that we're trying to get out here today?
Okay, I think the key takeaway here is, just catch it early. Do those periodic checks on yourself. Ask yourself those questions about your sleep and your appetite and your energy levels. And if you're feeling that anything is different than your norm, talk to your physician. Go to your PCP, talk to them, or call a therapist. Take action right away before it gets to something that is much more difficult to treat or can end up in like some major crisis.
Yeah.
So,
And that's really the problem with health in general. We wait till we're really sick. Our tooth really hurts.
Right.
We're so depressed we can't get out of bed. Hey, you know what? Preventative medicine's always the best.
We've waited too long.
Listen to your body. Listen to your soul. It'll give you a message. Follow the message.
Exactly.
And we are in a really exciting time in terms of all wellness for, especially here in the United States, but I think elsewhere, is that we are really starting to look at mental health and substance use disorders right alongside with all other medical conditions, and the stigma is starting to be erased, and so there's absolutely no shame, and it's very easy to go into your primary care physician or anybody else and say, look, I'm having some signs that may tell me that I'm depressed or anxious or whatever, and to talk about those things and receive help like never before. So it's an easy time to talk about that stuff, so take advantage of it.
It's definitely an easier time.
Easier, sure. Yeah, sure.
That's for sure.
Yes.
So, Bree, we want to thank you very much for being on the show today, and we can't wait to have you back.
That's right.
Thanks for having me.
I'm going to have Stephanie. We got to get you back.
It was good being here and good to see you guys again.
And some great information. And the biggest thing is, hey, you're not alone out there.
That's right.
So I know when you're feeling bad and you're depressed and you're in the dumps, you feel like you're all alone. You don't have to be.
Right.
That's the biggest message. We want to reach out, realize that
there's help.
There's help.
There's hope.
So pay attention to yourself and the folks around you. And if you or a loved one needs help, please reach out to the resources. One more time, if you are traveling on the 14 South, pay attention. There's slow traffic due to a car fire that's turned into a brush fire on the 14 near the 5 freeway. Again, thanks, Bree, for being on the show.
Yay, Bree.
All right, folks, this is Families in Action. Thanks for an outstanding week. We will talk to everybody next week on KHTS Radio. Thanks a lot.